Good morning. My name is Giuseppe Morgi and I'm the chairman of the Department of Urology at the University of Catania. I will introduce an important paper published on the issue of June on British Journal of Urology, and the paper is entitled Patterns of Prescription and Adherence European Association of Urology Guidelines of Androgen Deprivation Therapy Prostate Cancer. The paper has been extracted from the choosing treatment of prostate cancer, so-called choice study, an Italian multicentre cross-sectional study conducted between December 2010 and January 2012, and it also has been founded by Luna Foundation on behalf of the Italian Urological Association and Takeda Pharma Company. The project involved 30 Italian institutes, including 9 radiotherapy and about 21 urological centers, which enrolled 1,386 patients treated with androgen deprivation therapy for prostate cancer. The outcome of the study was to evaluate the adherence of androgen deprivation therapy to EAU guidelines. Following me, I will introduce Dr. Giorgio Russo that will explain the study, the materials methods, the results and the outcomes of the paper. And finally, I would like to thank British Journal of Urology for this kind invitation. Thank you.
Hello, my name is Giorgio Russo and I will talk to you about the methods and results of the choice study. First of all, I will explain current indication of androgen deprivation therapy by EAU guidelines. Patients with positive pelvic lymph nodes and patients with metastatic prostate cancer should receive androgen deprivation therapy. Furthermore, it should point out that some patients could receive inappropriate androgen deprivation therapy prescription with consequence among cost for health system and also among the occurrence of side effects. Based on these premises, the aim of this study was to investigate the pattern of prescription of androgen deprivation therapy in prostate cancer patients and also its adherence to EAU guidelines. The final cohort of the study was composed by 1,075 patients. We defined discordant ADT as ADT received as primary therapy, ADT received in adjuvant to radiotherapy in low-risk group, and also ADT received before radical prostatectomy. After dividing patients according to the adherence to EAU guidelines, we found that 285 patients received discordant ADT, and in this group about 40% of patients were categorized as low or intermediate D'Amico classification risk group. We also found that patients received ADT in all risk groups according to the D'Amico classification, and about 50% of patients in low, intermediate and high risk group received inappropriate ADT. Patients who received discordant ADT were more likely to receive complete androgen blockade respect to patients who received adherent ADT prescription. At a multivariate logistic regression analysis adjusted for all clinical and pathological variables, we found that some geographic regions in Italy were more associated with discordant ADT prescription, and in particular Central Italy and South Italy. So in conclusion, we demonstrated in this study that adherence to ADT prescription according to EAU guidelines was low in Italy, and it is influenced by geographic areas. Also, some patients received discordant ADT for the presence of pathological Gleason score less than 7 or equal to 7 and a PCA less than 10. So health makers and urologists should consider these results and set policy strategies to overcome this risk. Thank you for the attention and for your time.